Hello, everyone. Welcome. We are live here on Facebook. And I just wanted to welcome everyone to our very important conversation today. And we will be getting started in just a minute. I just want to give people a chance to join in on Facebook and join our conversation. So I'll just be quiet for just a second and we're going to get started. Just a second. So we have some people joining. So thank you for coming on. All right, well, we do have some people on. So I'm going to get started. I do want to thank everyone for joining us today for this important conversation and a discussion around COVID-19 clinical trials. And we'll also get into contact tracing and how that all ties in together with public health and health equity in general. And this is really important topic for this week because it's very timely as it coincides with Cook County's second annual Racial Equity Week, which President Pretwinkle started last year. So as many of you probably have known and continue to hear about the unprecedented levels of disparities in healthcare outcomes during the COVID-19 pandemic, especially in our Black and Brown communities. And Chicago and Cook County is not unique to any of the areas across the country, but we are focused on what's happening here because this is where we are. And as you know, the South suburbs has been particularly hit hard by the virus. As a result of that, earlier this year, some of you may have been on when I hosted a series of Facebook Live town halls that brought together experts from healthcare, mental health, nutrition, exercise, and public safety so we could educate our residents here in the Southland about the problem of healthcare disparities. Although I will say that although we were focused on, again, what happens in the Southland, it's not unique to this area just by itself. So COVID-19 and the social determinants of health contribute to these disparities. Today's town hall is a continuation of this effort, and I am truly grateful and want to thank our experts who are joining me today for taking the time out of their busy schedules to help educate us on COVID-19 clinical trials and how they affect health equity. This is going to be an ongoing topic of conversation that won't just start and end today. It's going to be long lasting throughout time. So we're so fortunate to have Dr. Raj Shah, who is the co-director and center at the Center for Community Health Equity and director of COVID-19 clinical trials at Rush University. And also joining us is Dr. Kiran Joshi, who is the Senior Medical Officer and co-lead at Cook County Department of Public Health. So thank you both so much for being here. I want to get started with Dr. Shah. If you could just introduce yourself as a little bit more in depth as to what was already said, but tell us about important work that you've been doing and how this all fits in with not only just clinical trials, but COVID-19 specifically.
Oh, great. Thank you, Commissioner Miller, for the introduction and for having this event during Racial Equity Week. As somebody who works as co-director for Center for Community Health Equity, we really appreciate these opportunities that we are presenting and providing opportunities for discussion and engagement around how we can improve racial equity and health equity in general. So again, my name is Raj Shah. I was actually born in Tanzania, in Dar es Salaam, and in East Africa. And I moved to Chicago when I was 7 years old. Lived in the suburbs southwest of the city in Bolingbrook. And after going and training to be a chemical engineer, I was lucky enough to go to medical school at the University of Illinois at Chicago. While I was there, I enjoyed, doing and engaging with people in various aspects of maintaining their health. And I decided to continue with a career in family medicine training. So I went to West Suburban Hospital and Health System in Oak Park. And while I really enjoyed my time there, delivered many babies. I never got one named after me, unfortunately, but I really enjoyed working with families and especially older adults. So I decided to go back to get more training in geriatrics, the care of older adults at Rush University Medical Center. And since 2000 and completing my fellowship, I've been a faculty member at Rush and been involved at the Rush Alzheimer's Disease Center in working with diverse older communities to help us to develop better prevention measures, diagnostic measures, and treatment measures to help older adults with common conditions like Alzheimer's disease. We found that as the population is aging and diverse, we needed to have engagement with multiple communities in order to better understand what it means to age well and to help support that. And I've been lucky enough in my career to be able to have the opportunity to come to many churches, to see individuals in their homes on the south and west side of the city, and then also to talk with them about the importance of research and research participation. And in the last 5 years, as co-director of the Center for Community Health Equity between Rush and DePaul, we've been engaged in trying to better understand why we see these patterns where we are seeing outcomes in health that are so different across the city and in the country, and knowing that we can find solutions and support people to make the appropriate changes. Based on my work in clinical trials over 20 years, I was asked during the early stages of the COVID pandemic and the surge in the Chicago area to participate and help lead our efforts at Rush around organizing the COVID-19 clinical trials as a director for Rush University. It was a challenging time with many sick people coming into our hospital systems, requiring the best clinical care we could provide. It was very clear early on that there was a disproportionate effect on African Americans and Latinos in our communities because they were the essential workers and individuals that were more at risk for exposure. And we did our best clinically to help people with the knowledge we had developed over hundreds of years and helping people through conditions where we don't always have the knowledge and solutions. But then we had to work on how do we connect and find solutions and find new answers. And that's what research is all about, being able to work with people voluntarily to join us in being citizen scientists to help us understand what are the options and best treatments that we can then share and use to help people to stay healthy. And that has really given me an opportunity to now be part of some of the efforts in the Chicago area to engage diverse communities around how we conduct our COVID-19 vaccine clinical trials. And I'm really looking for this opportunity to talk a little bit about the history about research, to talk about some of the engagement of African Americans, Latinos, Native Americans in the development of knowledge, where we've sometimes fallen short in the research world, how we've learned from that, and how we've tried to create a more respectful and safe environment where we can all work to find solutions together. Really appreciate this opportunity, and just wanted to kind of, we didn't want to show slides, and we wanted to have this more engaging. So to just have a conversation and to make sure that we discuss the key concerns the community members have around participation and what they're hearing in the news about clinical trials and what they mean. So thank you again for the opportunity to be here, and really looking forward to the conversation we're about to have.
Thank you so much, Dr. Shah. That is so important for us to hear, and definitely value your clinical expertise on this subject. So next, I'd love for Dr. Joshi to introduce himself and explain a little bit more about your role, the role of public health in this whole conversation around COVID-19. I know you have been talking and living this every single day since this pandemic began, and what that means to us in Cook County. But I keep stressing the fact that although we're focused on Cook County, this is a universal conversation. So thank you, Dr. Joshi, if you just wanted to go ahead and talk from your perspective.
Absolutely. Thank you so much, Dr. Miller, for the opportunity. I really appreciate being here with you and with Dr. Shah. You know, we share that both of us are actually from the suburbs. I was born in Oak Lawn, though, in Evergreen Park. I grew up in Oak Lawn, so it's really special to me to be talking to a group of folks from the Southland. It's got a special place in my heart. So I also, like Dr. Shah, went to medical school here in Chicago at the University of Illinois at Chicago. Did a residency, did an internship at Stroger, actually, back in 2003, the year it first opened, and have just some amazing memories of taking care of patients in the trenches from back then. Finished my training in family medicine at Illinois Masonic, and then went on to do some training in public health and preventive medicine at Johns Hopkins. I've worked in a number of positions since then, including working in global health as a consultant for the World Health Organization, doing some health informatics or IT type work at Norwegian American Hospital on the West Side, and then most recently in my role here at the Cook County Department of Public Health. I also, I might add, I'm really proud to take care of patients at Stroger Hospital. I am an attending physician with the Department of Family Medicine there, and it's, you know, and this isn't an overstatement, it's the honor of my career to take care of those patients, many of whom have been turned away from other institutions. At the health department, we provide a number of different services and serve a number of functions. I do want to make clear that we are the state certified local public health department for most of suburban Cook County. So we are focused on the suburbs, and it is a huge jurisdiction. So we have 2.5 million people, which is the same population as the city. We have 125 municipalities, all with their own mayors and often police departments, fire chiefs, et cetera, a number of different school districts. And so this really makes it a pretty complicated, complex jurisdiction, but that just means that it's all the more interesting. I'm always learning something new about this wonderful county. So we have a number of units at the health department, including units that, as I'm sure you're aware, focus on infectious diseases and communicable disease control. We have an environmental health unit that focuses on restaurant inspections and so forth. A really strong public health nursing unit that goes out into people's homes to make home visits to children, to infants that are born with developmental issues, to make sure that they're on track to be as successful as possible. We also have a public health emergency preparedness unit that is intended to plan for exactly the kind of emergency that we have been dealing with for the last 6 to 7 months. We also do a lot of work on chronic disease control and try to spread the word about the importance of what's driving the inequities that we're here to discuss this morning. just a couple of words about COVID-19 and the current situation in suburban Cook County. I think, as Dr. Shah mentioned, we did have a surge here of cases in March and April, with a coexistent increase in hospitalizations and deaths. We're seeing that same kind of increase today. Very recently, we were seeing numbers in terms of case counts similar to what we had been seeing back in March and April. But we haven't been seeing the same number of deaths and hospitalizations. And so if there's a silver lining here, it's that. And the reason for that is that the driver of these cases has really been a group of folks in their 20s. And as we know, fortunately, 20-somethings just don't get as sick as older adults, right? And so again, I would say that's a good thing. However, nobody, lives in a vacuum, and the concern is that those folks, those 20-somethings, could be driving ongoing transmission of COVID-19, and also potentially be transmitting COVID-19 to folks they live with, who may have chronic conditions, who may be older, all factors that put them at risk for worse outcomes for COVID-19. So this is Equity Week, and I would be remiss if I didn't talk about the incredible, appalling inequities that we're seeing around the country related to COVID-19. So rates of COVID-19 are over 2 times higher among African Americans as compared to their white counterparts, and they're 3 times higher among Latinx folks as compared to their white counterparts. And I think in public health and more broadly throughout our society, there's an understanding that these inequities are the results of years, decades of deeply racist policies. And when I say that, I'm talking about policies like segregation, which you wouldn't normally think of in terms of public health, but really you can draw a straight line from segregation to poverty to the wealth gap, and then over to the differences in health outcomes that we're seeing. So a couple of words about our COVID-19 response. We've done a lot of work across the county, focusing initially on long-term care facilities. You may have heard in the news a number of stories on the significant toll of COVID-19 on the residents of long-term care facilities. So we spent a lot of time talking to those long-term care facilities and providing them with the guidance they needed to navigate these difficult times. We've also worked to identify instances in which workers were reporting to us that their workplaces were just not safe. And so we worked really closely with the Illinois Attorney General's office to make sure that they were aware and that we were providing business owners with the appropriate education and guidance they needed to keep their workers safe. We also know that for people of color in particular, it may be difficult to isolate or quarantine effectively in their homes because many people live in multi-generational housing or are housing unstable. And as such, we've provided an alternate housing option for those folks. Finally, contact tracing, which I believe Commissioner Miller mentioned earlier. We have contact tracers on our staff. Contact tracing is really the bread and butter of public health, and we've been engaged in that work for decades. However, the rise of COVID-19 has really required that we get more resources for that. And so we have a pretty large grant from the Illinois Department of Public Health to rapidly stand up a really large contact tracing initiative, and we've been working really hard on that. So we're going to be hiring nearly 400 people over the next few months to assist us with that work. Finally, I just wanted to close out with a couple of public health messages. which are for everyone. If you're in contact with others and out and about, please wear a mask. We have a masking campaign that is launched. There's a dedicated page on our website to masking, and I'm aware that our good friends at the Cook County Department of Emergency Management and Regional Security will soon be launching an effort to make masks aware, particularly to communities that are most vulnerable to COVID-19. When you're out and about, also, please make sure that you maintain your distance. It's really important that you stay at least 6 feet away from others. And 6 feet is not an absolute number. The further away you can be, the better off you are, particularly if you're out there exercising. And the reason for that is that we think that the main way that COVID-19 is transmitted is by people's sort of spit or small droplets that kind of come out of your mouth if you're talking or singing. And when you're exercising, there's just a lot more of that stuff coming out. And then finally, I want to end by saying, make sure that you're washing your hands. Wash them for at least 20 seconds. That's the birthday song twice over, and you'll be safe. Or be sure to use hand sanitizer with at least 60% alcohol. So I've said a lot, and I want to be respectful of my colleague, and so I'm happy to have discussion. Thank you.
Thank you so much. You covered so many important points that I do feel people have heard that before, but we have to constantly remind everyone that we are still in a pandemic status. We are not even in an epidemic status. We are in a pandemic status, which is above an epidemic. So I appreciate that reminder. And before we just go into more about the clinical trial process and what that looks like, Dr. Joshi, can you just explain very quickly for people to understand, if a contact tracer person reaches out to someone, what does that conversation look like? Should someone be afraid to answer those questions? And how will people know to give them the right information?
That's a great question, Commissioner Miller, and I really appreciate you raising it. We're very concerned about the current environment in particular, where people are understandably afraid and they're distrustful of the government. So very much in understanding of that. I think a couple of things. We are launching a campaign very shortly around contact tracing to ensure that people are aware it's happening. So we want the general public to understand that they may be getting a phone call. We know, like I personally, when I get a call and I don't recognize the number, I don't usually pick up the phone. So being very transparent about that, right? I get that. So we are working with our cell phone carrier partner and with various other partners to make sure that when we call, there's a specific set of words that show up in your caller ID that make it clear that it's public health calling. And our campaign is going to be called Answer the Call, right? So we want as many people to be aware of that as possible. We're also planning to work with community-based organizations who are, trusted on the ground by the community to work with communities to make folks aware that they may be getting their phone calls. And finally, regarding this issue of trust, I want to assure everyone that we take confidentiality and privacy very, very seriously. We are, even during the interview process for our contact tracers, we make sure that we're very clear about the importance of those issues. If you get a call from a contact tracer, the questions that you could expect are essentially that, information that you were in contact with someone with COVID-19 and that you're being notified of that so that you can take the appropriate precautions to take care of yourself and to protect your loved ones. And that advice would be to stay quarantined for 14 days. Now, we understand that that can be difficult for some folks. And we also are pairing our contact tracer teams with care coordination teams that can help provide resources So if, for example, somebody is housing insecure, we will work to see if we can provide housing. If someone needs a hand with food, we will connect them to a food pantry. So those are just some examples of the resources that we would bring to bear.
Great. That's great to know about the number showing up on the phone. It's kind of a common occurrence in everyone's house. Me, my husband, and the 2 kids. When the phone rings, nobody runs to answer it. So nobody knows who it is. So that will be a great advantage for people to know this is important and they need to answer. So Dr. Shah, let's get back into the conversation about what the work you're doing at Rush, the COVID-19 clinical trials that are ongoing right now, and really why the importance of people enrolling in the COVID-19 trials, and even more importantly, the huge number of people that will need to be enrolled in a vaccine trial and the work that you're doing around that.
Oh, thank you. And I wanted to follow up on Dr. Joshi's comments about one thing we have to remember about research or research participation, even though it's in the news a lot right now about the need to find a vaccine, need to be part of the research to find solutions that will help us all, is that we still have to provide our best care with the knowledge we have first, and then we think about being part of a clinical study. So a study or a clinical trial will not replace what we have to do every day anyway. So we, as Dr. Joshi mentioned, even before you think about entering a study or a trial, you still need to wear a mask, and you still need to, maintain some physical distancing, wash hands. I think the other thing I would add is that now that we're entering the fall and we already have flu vaccination started, and we're starting it a little bit earlier, it's important to get a flu shot and get a vaccine for flu, because that's something we know that works. How do we know it works? People were part of clinical trials with flu vaccines that showed that they prevented people from getting disease and helped to make sure that they, when they did get it, it was less severe. And that took people to take that initial step to help out, to figure out that the flu vaccine works. And now we have to keep encouraging that. And it's really important. So what's going on in the space of trying to find solutions, or how do we go about finding solutions? So the most common thing is we look at what we've done before in other similar situations and then try to do the best. That's why we got the ideas in public health around social and physical distancing and around the needs to wear masks. We didn't do a clinical trial where we told some people to wear a mask, some people not to wear a mask, and see what happens. But we knew enough about the way the disease was going to be processed and prior experience with using a mask to reduce the amount of spread of water droplets that were educated guess that was a good way of solving the problem. And then we followed and we monitored and we saw that numbers were improving when people were wearing masks, right? But now when it comes to medications and treatments, we usually ask for more. Sometimes we can take medications that are already been used before and try to repurpose them to try to help. And that is what we've been trying to do with some of the antiviral medications. A common one that people talk about is a medication called remdesivir. And it's a medication that essentially is given by infusion with an IV into somebody's veins that helps them to block the virus from replicating. And they had initially been working with remdesivir in Ebola. And they saw that it was helping, and that the current SARS virus, once they isolated it in rapid times, I mean, within 2 weeks, they knew some of the structures about what the virus was like, which is incredible. It's a statement of all the scientific, work we've done as humankind to be able to get to that point that in 2 weeks we would know the structure of an organism that was causing a severe disease. But they used that information and saw that remdesivir may be helpful and then started some of those studies. The first studies that were done were really what the people in most need. The people that were coming to our hospitals, the ones that were in the ICU, where we were trying the best supportive care, and then we needed to see if there was something that we could calm the system down. So the first approach was, can we attack the virus itself? And that's with the medications like antivirals, like remdesivir. The second piece that people started realizing is what was happening is that the virus itself and the fight our body was doing against the virus would sometimes create more damage than anticipated. So our inflammation would increase in our body. We would form little blood clots, and that the combination of those two things would make it harder for people to recover. And so then it made us have to think about, are there other options than just antivirals, and to think about things that can calm our own system down with medications that what we call anti-inflammatories. So we've been exploring a wide range of medications. Some of the medications that have already been used and approved for common diseases where our own immune system is too hyperreactive, and then try to see if that would help. And those studies are still ongoing. But as we got better in our care and the decisions about physical separation and the public health measures allowed for the number of people to be hospitalized to go down, we realized we had to switch tracks, right? Like we had to move from the most severe individuals and helping to treat them and finding solutions to now having to find solutions for people that were diagnosed that they had the infection and maybe just starting to show symptoms and maybe were at home. And there it would have been harder to give everybody an infusion and send a nurse out and to do those type of things. So we had to think about different solutions. And then we had to think about what we call sort of early prevention and prophylaxis to somebody who's been exposed because a family member has been diagnosed in the home to have COVID. How do we stop them from showing the symptoms or the virus early? And finally, we move into total prevention, which is the idea of vaccines, which is we give something to get our immune system ready to recognize if it's exposed to the virus. So we have multiple stages of interventions that I've been working on around the city, in some ways in the county, suburban, and the city with our health system. We have capabilities with researchers to study many of these treatments. But it requires us to work and to talk with each person one at a time to see if these are the right options to find solutions together. And I will tell you this is important because sometimes we're hearing that the messages are getting mixed. My wife practices as an endocrinologist, and she's a diabetes, and they started giving the flu shots about a week ago, 2 weeks ago in their office to patients with diabetes. And in the first week of her giving the flu shot, she had 2 to 3 patients ask her, does this flu shot also have the COVID-19 vaccine in it? And the reality is it's not there yet right now. I know we all want it. I know we want that solution. And we are rapidly progressing in our understanding and getting to the point where we can get information to see what vaccines are safe. And just to give you an idea, Commissioner, and the audience, it usually takes a vaccine to be developed in the United States 20 years. 20 years, all right? We are doing this in 18 months. So just think about the time frames. It's incredible when you really consider that. And it's had to come in collaboration between groups like the National Institutes of Health with vaccine developers in a program called Operation Warp Speed to be able to identify some candidates for vaccines, and then to be able to start mobilizing our public health system, our health system, our researchers to be able to do these studies. And why is that important? Because a clinical trial or a vaccine study requires you to see a difference between the group that gets the vaccine versus the group that gets a placebo, to follow up to 60,000 people for about 2 years. And that's a real challenge to be able to do. Right now in the Chicago area and in the suburbs and Cook County, we have at least 5 institutions that have been participating in onboarding these national and international clinical trials through Operation Warp Speed. And there's really a need to have open discussions about what that means to participate. I will say, because of Racial Equity Week and even Dr. Joshi's comments about who is being affected by COVID the most, we have to make sure that we include as many diverse people in the study as possible. We know our system of trials to get new drugs, unfortunately, does not include enough African Americans, Latinos, and Native Americans that it should. On average, like when we look at a condition like heart disease, when they looked at studies that involved over 300 participants over decades of work to find new drugs, only 4% of those 300,000 participants that developed the new drugs were African American. And we see this over and over again in multiple studies. And we know there's reasons for this, right? And in my experience, one of the biggest reasons for this is we don't take the time as researchers, as community members, as public health officials, to have open conversation and respectful conversations to allow diverse groups to make the appropriate decisions for themselves. And we have to do it with a lot of respect. We have to give all the information we can that we know, even though it's imperfect and we don't know everything, and allow people to make the best decisions about what's the potential benefit, what's the potential downsides, and what are the alternatives. And again, because this is voluntary, I know that some people will make a decision, it's not for them. And that is okay. It's a matter of having the conversations so that enough of us will be willing to be part of the work as citizen scientists to find the solutions that will help generations to come. And it just takes time. It takes forums like this to be open, to ask, be available to ask questions and to answer them, and then to start working through how do we get it so that we do not develop vaccines for COVID, where the majority of the people involved with that were the ones that were young and relatively healthy, the ones that were of higher socioeconomic status, the ones that were better educated. We need this to incorporate everybody, and especially the ones and the communities and families most at risk. And we're working very hard nationally and even locally in difficult times, because we can't do the same things we used to do. Like when I would do studies before, I'd be going into the community, giving presentations at churches, meeting small groups of 20 people at a time, and spending my weeks doing that to just have those one-on-one conversations. And we just don't have those same tools right now. But forums like this, we are learning, are the tools we'll have to use. And then just be available for people to ask the right questions and to go forward on how do we get better at engaging. And we will get to a solution. I know we will. We are innovative people. We are diverse people. We all see the value of us getting to a point where we don't have to fear or worry about COVID-19 like we do right now. We just have to take one step at a time and work through it and make progress and make sure that what our progress is will lead to safe products that will help the majority of people that need it. So I'll stop there. I know I talked a lot about the different things.
No, that's great. All of that information is so valuable, and many people probably just only heard that for the very first time. So thank you so much for that. One thing that I just wanted to touch on, just if you could expand the conversation around the reluctance, especially in the African American community, for joining clinical trials and what you're doing right now to encourage that conversation. I've heard some people are getting letters in the mail from their health plan encouraging them because they fit a certain demographic to participate in the trial for a vaccine. There's been letters that have been gone out through the Historically Black College Network. HBCUs are sending out letters encouraging people to join clinical trials. So how can especially for the work that you're doing, Dr. Shah and Dr. Joshi, on a public health standpoint, how is that conversation being had and being expanded so that we get to that huge number? I think you said that when in a prior conversation, if you could remind us of the number of people that need to be in a clinical trial, that's why each person matters to join it. I don't know, Dr. Shah, you want to pick that up, or Dr. Joshi?
Yeah, I mean, if I could just make a comment and then I'll turn it over to my colleague. And it's that, that same kind of distrust, Commissioner Miller, that you mentioned earlier, I think is connected to the distrust around participation in clinical trials on the parts of Black and brown people. And I think, again, it's completely understandable, right? As an intern, as a young intern at Stroger Hospital, I can't tell you how many patients said to me the words, "I don't want you experimenting on me," right? Patients who refused treatments that I was trying to provide in good faith because of the actions of some pretty unethical researchers from many years ago who were involved in something called the Tuskegee study. Now, not everyone knows what the Tuskegee study was, but many, many people have heard that word and understand the meaning behind it, which is that the government came in and did something profoundly wrong to human beings that were not treated in the way that they should have been. And so in terms of the consequences from that and what's being done to address it, I'm going to defer to my colleague, Dr. Shah.
Hold on 1 second. Dr. Shah might have had a disconnection. Oh, there he is. Dr. Shah, can you hear us? He might be frozen. Yeah. Dr. Shah, can you hear us? Oh, there you go. We just wanted you to explain a little bit more about that portion of the resistance to join a clinical trial. Well, until he catches back up, Dr. Joshi, do you want to just explain a little bit more?
I can hear you. Can you hear me?
Oh, okay.
I can.
Okay, we hear you now. Yes. Go ahead.
Uh-oh.
Oh, well.
Dr.
Joshi, yeah.
Yeah. So I think a couple of things. I think it's incumbent on us as leaders and public health professionals to do our best to communicate consistently and transparently about the reality around clinical trials, which is that the current state is that we do not have enough Black and brown people in these trials to make effective decisions and effective decisions about treatment or prevention. And so it would, I think, be really beneficial to communities of color to participate. And that's not on them. I think that's on leaders in research in particular to do targeted intentional communication and outreach in the form that's happening here and in some of the forms that you mentioned earlier, Commissioner Miller, to raise awareness, build trust, and ultimately yield in better recruitment from communities of color. And until that happens, we're going to have this big gap, right? And unfortunately, it's like it's going to be, you know, communities of color that suffer from that.
Well, thank you. We'll wait for Dr. Shah to get back on, but we did have a question in the chat that was from Annette, and she was wondering that there's some young parents considering resuming swim classes for children as young as 3 years old. And does chlorine decrease the chances of contracting COVID, and is it safe to resume swim classes?
Yeah. So let me just say that the official recommendation on this is that there's no evidence, there's no research that shows that COVID-19 can be transmitted through any kind of like recreational water. So we don't think that that's a major way that COVID-19 is being passed between people. So I think the Illinois Department of Public Health and the CDC are okay with swimming pools reopening with capacity limits. And I think it's like 50%, if I'm not mistaken. Now, like that's the official guidance, right? But it's never one size fits all, particularly for these kinds of large settings. And every jurisdiction or city or county is a little bit different. And every swimming pool is a little bit different, right? So what I would tell you is that it should be safe, but I would certainly want to scope out that pool and see how big it is, make sure that there is appropriate space for physical distancing. Again, it should be at least 6 feet. I would, as a parent, advise you to maybe try for a little bit more than that, particularly if they're like really little kids. Because, you know, little kids just love spitting stuff out of their mouths. That's the reality, right? And so I'd say I'm okay with it, but with a note of caution. And I think I provide a link to the CDC website that could be shared that speaks to some additional guidance around that.
Great, that's helpful, and we'll definitely share that. Okay, thank you. Dr. Shah, are you back? Can you hear us? Well, we'll send you a message. Dr. Shah, I don't know if you can hear us now. I don't know what happened. But I guess one of the other things that's important to discuss, and this would be for both of you, but we can certainly start with you, Dr. Joshi, just as we're kind of coming towards the end, is the meaning of public health really is for the public, right? Yeah. So when we hear people, you know, some of these people who are anti-maskers and don't want to wear a mask or don't think it's as important, but how in the theories of, you know, talking about what does public health mean in general, we see that it means a lot, especially as it relates to something like a pandemic, COVID-19. So what's the philosophy from your standpoint, you know, being in charge of such a large public health system and how the public plays into that?
Yeah, that's a great question. Thank you for that. You know, there's a lot of folks, public figures that are taking this like finger wagging approach, right? Like, how dare people not mask? How, you know, and I think that's one approach. I don't know that that's the approach that I prefer. And I know that there's research that's starting to show that it just doesn't work. So there is a really great story in the Sun Times that someone shared with me from today that sort of talked about how teenagers and young people do not want to hear about what they can't do, right? And if you think about it, that makes sense. Who likes being told what they can't do? Nobody. And particularly if you were a teenager, you know that that was the case, right? Like you spent your teenage years hating on your parents for telling you what not to do. What they want to hear is what they can do and what they should do. And what's really kind of interesting is that there's data that shows that it's because they want to protect their loved ones, right? So they want to do the right thing. We need to give them the tools for how to do it in a way that's not judgmental and acknowledges that they care. And we know they care because they have been out there in force over the recent months over a number of different issues, right? And so I think if we can align our communication around that, we can make a difference. I think people know that they need to protect their loved ones. They know that they need to protect the most vulnerable among us. And I think if we talk about things in those terms, we can get to success.
Great. Yes. Well, I'm the mother.
Sorry, I got cut off. I think I got back on.
Okay, great. So Dr. Shah, do you just want to tell us in these last few minutes about what's the most important part about what you're doing to encourage participation, especially in the clinical trial vaccine portion of the, your research there? And how does that conversation look so people can feel comfortable thinking about it and what it means to them?
Yeah, so some of it is making sure we get the information out. And then also I wanted to let people know that if they want more information about how they can participate in COVID-19 clinical trials, there is a national information place called the COVID Prevention Network. And they have the capabilities where if you're interested, you could sign up on their website. It's national, it's based out of Seattle, Washington. And if you're interested, you can sign up. You set up an email and a password, and then they ask you questions about how your health has been and your level of interest. And then that information will connect you to studies that are ongoing that you may qualify for, especially around COVID vaccines studies in the area. And then I will try to post that link as we're kind of finalizing our conversation here and share it in the comments so that people can have it. And then we're also doing our best to work. Oh, go ahead.
Oh, go ahead. Go ahead.
Oh yeah, we're just working our best with our clinicians and also working with primary care doctors who see the majority of individuals so that they're aware of the vaccine studies and can also be a resource to help explain some of the questions people may have. We want people to have the conversations at their dinner table about the vaccine study or any clinical trial, right? Because what we find is the three factors that make somebody decide whether they want to participate in a clinical trial is will my friends say that I should do this? Will my family say that I should do this? Will my primary care doctor say that I should do this? So we want to make sure that there's all these other avenues that we can have open and available for people to be able to ask questions and find information.
That's great. Well, so in the last few minutes, this has been so insightful. I would just love for both of you to just wrap up with some final thoughts. And really, I like to give people some marching orders. So aside from wearing your mask and washing your hands, which is absolutely important, what are some other things that are, or just your final words on what you think is important for people to take away and what they can keep doing? Because as we know, this pandemic is not over. It's not nearly over. And we still have, unfortunately, so many deaths due to COVID-19. So Dr. Joshi, you want to wrap us up?
Yeah, I mean, I think what we've really seen is that this pandemic has unmasked the underlying reasons for the inequities that we already knew existed. And it's my hope that we will work together as a society to address what are really societal problems, right? And finally, I just want to say, yes, wear a mask. Yes, social distance, wash your hands. Do it for yourselves, but also do it for the most vulnerable among us. Thank you.
Thank you. Dr. Shah?
And then, yeah, I would say as far as next steps or activities that people can do is please have the conversation about being involved in studies that will help to develop interventions like a vaccine at the dinner table. It's just important to have those conversations in family settings and community settings, even if it's on the phone, to say, hey, I heard that we're doing these COVID prevention studies. What have you heard about it? Or what information do you think we should ask to make sure we get all of the information to make the best decision on how we can participate? And that's the way we will learn together, is to have these conversations around the kitchen table, and then to just ask the professionals, the doctors, about, hey, I'm hearing this on the news about this COVID study or this clinical trial. What can you help me find information about this, and how can I get connected? And we all will have to take a part in making a difference. We all already have and continue to do so. And that's the way we will get answers. Humans are incredible that way, that we can find the best in all of us, even in difficult situations, and find the answers that make our lives better and the lives of many generations to come. So really appreciate the opportunity to spend some time today.
Well, thank you both so much. We are so fortunate to have both of your expertise on public health and clinical trials and research right here in our own backyard. So we are definitely grateful for your leadership and professionalism in this really changing environment that is like changing minute by minute every day. So thank you for sharing this time with us. I appreciate you being here, and I know that as time goes on, we will have more conversations, and we will probably pull you back in for something like that. Well, thank you all who were listening today. You can share this link because it will be up and it's shareable to get the information out. So please encourage people that you know to listen to this important information so they can understand what science says about this disease and why that's important. So thanks so much for being here.
Thank you.
Thank you.